You would probably damage, injure, or kill yourself if you actually could put 2,000 pounds per square inch of force into tissue. Hey everyone, Dr. Todd from Gonstead Spine and Wellness, and in this video we're going to show you the best tennis elbow rehabilitation exercises. Now before we get started, make sure that you subscribe to this channel. Understand we serve two audiences. One is our community, our patients, our people that just want to get great information, whether you live in Idaho and you want to travel and come see us, or you just want to understand how to get healthy and how to stay healthy for a lifetime. The second audience are chiropractors. We teach chiropractors how to integrate their practice with corrective exercise and functional movement. The stuff we're going to talk about here today, a lot of it applies. We have a program called MoveNowU. Go to MoveNowU.com if you're a chiropractor to check that out. And what we're going to talk about today is we're going to talk about some exercises, some great rehab exercises for a tennis elbow. Remember, I had tennis elbow, had surgery, didn't practice what I'm preaching now because I didn't really know what I know now. This was years ago. And if you haven't already, make sure you watch the last video that we did where we talked about more about like the causes of tennis elbow a little bit. Actually, technically it was a worst exercise to do, and we get into some of the details of how this stuff arises. That link will be in the description below. Might be a link floating around here you can click on too. I don't know, maybe it is if it magically appears, but let's get rolling. All right, here we are. We have some of our home mobility tools in front of us. Now keep in mind, this is the stuff in our practice. We have our patients get these MoveNow mobility tools, these home mobility kits. Our chiropractors that we train, they provide these for their patients. Just so you know, so you don't miss out, if you check out in the description below, you'll find some ways that you can get some of these as well if you don't have access to us or one of our MoveNow doctors. Okay, how cool is that? Let's go through some of these things. Before I explain how to use them, let's talk about what this stuff is. We have two different resistance bands. This is not necessarily going to be used for these protocols, but this is part of this kit. We have a bag to carry some stuff in. We have this thing called a neck trigger point tool, which I'm going to show you how this works, not for the neck today, but actually for the forearm. Pretty awesome. Bet you didn't know it did that. J-cane, which is used to get to certain parts, different muscle tissue, lots of protocols with this. This also does not apply today, but I just wanted to show you. We have a double lacrosse ball. This definitely applies today. Grabbed one of my wife's hair bands because I couldn't find a rubber band for this. I'm going to show you something you can do for some exercises. This little thingy that I found somewhere online that's also a way for activating forearm, and I'll explain. And then lots of companies make these. Just make sure that when you buy one of these, if you track one down, don't spend $400 for one because you don't need to. You can usually get these for under $200, okay? This is a vibration tool, and this is something that we had branded for us with MoveNow. Pretty fancy, pretty awesome. Most of these are all the same though, if you want the honest truth. So don't be fooled by the hype on paying lots of money for one of these things. All right, with that said, before we jump in and talk about how to use the tools now, I want to talk about some principles that apply to pretty much everything, any sort of injury, any sort of rehab. The goal that we want to do is that if you have irritated tissue, you don't want to irritate it more. That's the first goal. In the case of a tennis elbow, or what's called lateral epicondylitis, you have muscles that then transition into tendons, and then the tendons insert into the bone, okay? Now, what happens is where the muscle turns into the tendon, right where the tendon inserts into the bone, that last little bit from here to here between my two fingers, that's where things get really irritated. That's where it hurts a lot and it gets inflamed. And it happens because the tendon is tugging at the insertion on the bone. And it's usually because there is increased tightness, and that tightness can actually happen because of weakness. Kind of interesting how that works. So you can have overactivity and tightness because it's weak, all right? So ultimately, you need to strengthen it. Ultimately, you need to have proper function between your flexor muscles on this side and your extensor muscles on this side. You want better balance. So before you jump in and start digging in all the tissues and following all these protocols, you want to make sure that you are paying attention not to further inflame the tissue. So this is where one of these little straps actually helps out tremendously. Let me explain briefly what this does. So I'm putting this strap right here, and what does this do? It artificially changes the insertion point of where these muscles attach into that bony prominence. In other words, if these muscles are tight and they are tugging on the tendon, and the tendon inserts right here, and the part where it inserts is very inflamed, by squeezing down right here, you're essentially allowing this area to have less stress. And that less stress right there is then going to allow that area to have a chance to heal, so that you don't feel it every time you pick something up or every time you turn your hand. And then when you bend your arm, guess what happens? It actually gets tighter in here. And when you bend your arm, technically that's when there can be some more load in that area. So it serves two purposes. You bend it and there's more load, and this squeezes down more, and it diverts more load off of the damaged tissue. It's really a very simple but genius way to be able to intervene here. And I'll tell you, back when my tennis elbow was really bad years ago, I had a couple varieties of these. The way to know where to place it, you basically palpate, you feel where you're tender and where it's hurting, and then you want to go a little bit past that point, and that's where the strap's going to go. Okay? If you're hurting from here to here, don't put the strap right here because it's too close to the elbow. When in doubt, err on the side of putting it further down your arm and further away from your elbow. You're gonna put that on, you can wear this, you can loosen it if you're not doing a whole lot of activity, and then when you do activity again, you can tighten it, and it will help give you a chance for these tissues to actually heal up. So that's the first thing. Now, next thing, when we go through any sort of thought process of how to fix tissue, first thing you want to do is you want to make sure that you improve mobility to the tissues that don't have proper mobility. So in this case, what tissues are we talking about? We have muscle in here, we have trigger points in here, we have areas that are gummed up, locked down, not really functioning properly, are painful. And if we can do things to mobilize that tissue, to almost soften up that tissue, that will help in the first part of this process. And it's essentially a pain relieving approach as well. So in this case of the forearm of epicondylitis, lateral epicondylitis, it kind of serves two purposes. You'll see in our other videos as we talk about neck pain, mid back, low back, different extremity issues, all of them are going to follow this order of things. Mobility, and then stability, and then reinforcing a pattern, and then loading and adding strength to that pattern. So again, mobility, stability, reinforcing the pattern, and then loading it and adding strength. Very important. So let's talk about some things to do with mobilizing this tissue. First thing that I would recommend doing is some level of what I like to call global mobility. Global means you're not trying to pinpoint really exact tissue quite yet. I would use some kind of vibration. If you don't have vibration, you could use something even like a foam roller, all right? And the way you could do this with a foam roller is you can put your arm on like this, put a little pressure over like this, and just roll back and forth. And if you're very, very acute, like your tennis elbow hurts a lot, this might be somewhat challenging, okay? You don't want to go right into the blade of your forearm, which is your ulna, so you're not trying to get into that bony part, you're trying to get into some of the meat of your arm, so you have to turn the arm over like this a little bit. And then another way you can do this is you can go thumb down this way, and you can roll this type of way, like this, okay? And when I'm doing that, I actually feel like it's actually a pretty good stretch slash it's needed on this tissue for me, and I don't have an active tennis elbow problem. How many times do you do this? How long do you do this? You do this for a couple of minutes, maybe 2 minutes at first. You're trying to tenderize the area so that you can go to the next step, which is focused mobility. That means you're going to target this area with more pinpoint approach, kind of like you start off with a shotgun and then you go with your sniper rifle. So that's my shotgun. My sniper rifle now is going to be something like a double crossbow. And side note, if you do have a vibration tool like this, You can throw this in the mix as well. The higher the setting, the less intense. It's kind of counterintuitive, right? So the higher vibration setting it is, the less intense it is. The lower the setting, the more like a jackhammer it is, more intense, okay? How long do you do that? For a couple of minutes. All these things you can do for about 2 minutes if you want to keep it simple. And I know everyone doesn't have one of these. It's not totally necessary, but if you have one, it's a bonus. Okay. Now, next part, we're going into targeted or focused mobility. You can put this down flat like so. This conveniently fits right into the blade of your ulna into your forearm. So the blade of my ulna is right here in the center of two part of the balls on the double cross ball. You put this here. Now, if I just do it like this, I'm just going kind of into like really close to the bone. Doesn't feel too good, doesn't feel too effective. The key is you take your other hand and you shift the tissue into external rotation. So the thumb starts to go this direction, so the palm starts to go up. And then I'm just gonna sink into this, start to put some pressure. And I wouldn't roll back and forth necessarily, unless you wanna do that just a couple times. That's not really the focus of this. It's to find tissue that's really tender and uncomfortable and then be able to go through a range of motion. So having a little bench like this or a table is nice because notice I can put my hand into extension and then I can curl my fingers and I can flex my wrist up like this and I can open and close. I can put a little more pressure if I want to. Yeah, that's a little spicy, right? Okay, and then I'm gonna move a little bit. I'm gonna find another spot. I'm gonna do the same thing, open and close. And what are you looking to do with this? You're really looking to desensitize the tissue. So a side note on what these mobility tools really do, they do not break up scar tissue. It takes over 2,000 pounds per square inch to physically break up scar tissue. Your body wouldn't be able to handle it. You would probably damage, injure, or kill yourself if you actually could put 2,000 pounds per square inch of force into tissue. So we know from the science that's not what we're doing, but we know that this works. So how does it work? It works by desensitizing tissue. It helps different layers of tissue glide and slide. This can also help by another means of improving what's called fluid dynamics, as far as moving fluids around. If there's stasis or non-movement of certain byproducts of abnormal muscle physiology, such as like lactic acid, for example, can help move some of these fluids. So there's multiple ways this works, but it does not break up scar tissue. So I wanted to point that out so we don't have to continue to perpetuate a falsehood. All right, that is one of the things we're gonna do for target mobility, focus mobility. Now here's where this tool comes in place, which is really cool. This is a neck trigger point tool. We use this to work on muscles in the neck. These are adjustable. This is part of our home mobility kit that our patients get, okay? We send these off to chiropractors all over the country and they use these with their patients as well. And like I said, if you don't have access to us or to one of our doctors, then check out a link below where we're gonna show you how you can get some of these tools for yourself at a super huge hookup and instruction on how to use them. So right now, so we can stay on topic, we're talking about lateral epicondylitis. This actually works for lateral epicondylitis as well. Because these rotate, how I like to do this is I rotate one up, one down, and guess what fits in there? Your forearm. So what you do is you bring this up over the forearm like this. You can also do this on a bench if you wanted to, like this. You can also just squeeze this together and do this, you know, sitting up. And you can move this around, go through some range of motion. Just the compression itself can be quite helpful as far as allowing some of these trigger point areas to relax. That's through a process called ischemic compression, which means if you can squeeze down a taut muscle tissue, that compression can actually decrease blood supply to that area. And when you decrease the blood supply to that little tissue, that can create a response where it is forced to relax and to stop being so taut. So ischemic compression has another mechanism of action when you use these tools in causing muscles to go from a dysfunctional and painful state to a more functional and non-painful state. I'm gonna work different parts of the forearm. I'm gonna make sure I go through range of motion. How long would I do this for? Probably 2 minutes, okay? You can search around all these different areas. So now at this point, let's say that I feel a lot more tenderized and mobile and just less pain and less tension here, which I do, but I also don't have an active lateral epicondylitis. So at this point, now the next part that we would want to do is some level of stability and patterning. What you can do this with anything with a long lever. So this is a J cane. We use this normally for trigger points like on the back and hard to reach places. But you can hold this in your hand and there's a little bit of weight to it. And so I can gently supinate my hand and pronate. So I'm supinating my forearm and my hand. And as long as there's no pain doing this, this can create some activation and stability in your forearm muscles. Now, if that causes any pain, you're not ready for it yet, and don't do it. But I wanted to throw that in there because there's not really a whole lot of stability types of exercises quite yet that I'd really recommend for lateral epicondylitis, but to follow our sequence of mobility, stability, pattern reinforce, and then loading, I wanted to at least touch on this part, which is the stability aspect. Pattern reinforce with this as well. Not really a whole lot to tell you. So let's get into more of the strengthening aspect, okay? Like I said earlier, I found one of my wife's hair bands because I couldn't find a rubber band. This is, if you have one of these at home, or a rubber band works better because this likes to slip all off your fingers. Rubber band will actually stick to your skin better. What you're gonna do is you're gonna open your fingers against resistance. And if I had a rubber band, it would work better because I'd be able to open my fingers wider and it would stick on my knuckles and it wouldn't feel like it's gonna roll off. You get the picture. You're gonna open against resistance. When you do that, you're activating forearm extensor muscles. Okay? Hold for a couple of seconds and then relax. Hold for a couple of seconds, then relax. Go through repetitions until it starts to get a little bit of a burn in your extensor muscles, and you should not feel it up in here. And if you do, modify how you do it. Here's a little tip. One of the tests you can do to see if the extensor carpi radialis brevis muscle and tendon is the one that's at fault here, or damaged or injured, is your middle finger attaches to that and activates it more than anything. So if you can hold your hand in extension, you push that middle finger down, and if that causes a pain right there, you say, oh, that hurts. Make sure when you do this exercise, you de-emphasize the middle finger as much. You don't push back as far with the middle finger, and you can usually do this non-painfully, okay? This is something that I found online. I thought it was a cool little idea. You throw these little deals over your finger. It's a little more specific than a rubber band, and you're gonna see that it accomplishes the same thing. I like to throw this on the thumb like this, okay? Or even in some cases, I feel like it's hard to extend like this, so you can even take your other hand like this and extend, okay? And that's actually a pretty good load. And I'm just extending against resistance. Okay, if it works for your thumb, you can do it. I just don't feel like I get enough range of motion. I like to really have my hand close and open against resistance. And you would do that for a couple of minutes, maybe sets of 10, 15 reps, take a little breather, then go after it again. Just from doing that, I already start to feel this really activate on this side. And then last thing I can show you is more of a gym exercise. We have a setup here in our home gym setup that I want to show you that works really well for developing even more strength. This is something you would do after you're out of the acute phase, after you no longer have any pain, after you've allowed this to calm down, wearing this brace like you should, or this strap like you should, icing the area, resting the area, having good supplementation, taking good anti-inflammatory supplements such as high-dose omega-3 fatty acids, turmeric, various things out there as far as joint and tendon support. We can put some notes below and talk about this more in other videos. And avoiding sugar in your diet, because sugar is such a pro-inflammatory food that anytime you have an injury, that's even more reason to clean up your diet and to cut out the sugar and the complex carbohydrates. Let's go on to the next piece on here so I can show you a higher level strengthening exercise. All right, last one here. This is more of a end level strengthening rehab exercise that you should be doing on a regular basis once you recover from the painful episode of lateral epicondylitis, and this will help prevent you from getting into this mess in the first place because you keep these muscles nice and strong, okay? This right here, it has a kettlebell attached to it, and I'm going into extension. So notice I'm moving this direction against resistance, which forces me to activate my forearm extensor muscles. You can go step by step, side by side. You can get into this position. I like to do like this. I usually put more weight on than this, but for the sake of the video, I started pretty light. And so I'm going into full flexion and then extension. And you can go through reps like this and you'll definitely feel it start to activate the forearm extensors. Now, if you don't have a setup like this, you can do something really simple where you can literally take a PVC pipe or a dowel rod and you can hook a rope to it. So you can drill a hole through it, tie a rope through it, wind up that rope, and then hook a dumbbell or some kind of weight to the bottom of it. That's traditionally how this is done. This is a fancier version of it, but I just wanted to show you how this thing works. All right, great. Well, thank you so much for watching. I hope that was beneficial for you as far as trying to find some answers to your tennis elbow problem. We showed you some low-tech exercises using the MoveNow home mobility tools, the home mobility kit. And again, this is something that we use with our patients. Our doctors use this. If you don't have access to us or our doctors, check out a link in the description below where you can find out how to get this stuff for you as well. And leave us some comments. Let us know what you'd like to see us cover, or if you have any other questions or things that you want us to go into more depth on as far as in the topic of tennis elbow. We would love to read your comments. We read the comments and we will respond. Again, my name is Dr. Todd Pickman from Gonstead Spine and Wellness. We serve two audiences, our public, you, our patients, and chiropractors. Go to MoveNowU.com if you're a chiropractor to find out more. When it comes to the health of you and your family, results matter most.